this time, we're going to check the horizontal canal. Okay? To come down, it doesn't have to be fast anymore because we're not checking it yet. So if you don't mind, Justin, right? Tyler. Keep your head forward and come all the way back. Just slowly. Come on back. Keep your head forward. Good. Relax your head, I have you. So now we're in the testing position. So we shouldn't see any nystagmus yet. We want to tilt forward about 30 degrees. How come? Orientation of the canal, exactly. Horizontal canal. And now we have to actually create a movement specific to the orientation of the horizontal canal, right? So what I want you to do is I want you to, not yet, but I want you to turn your head quickly to the right. I'm going to support your head while you're doing it, but you're going to do most of the work, okay? And the idea is you want to turn all the way to your shoulder. And you don't have any neck pain, right?
Correct.
Good. On the count of 3. 1, 2, 3. Exactly. We're watching his eyes for nystagmus. Geotropic versus agiotropic, right? We're watching his eyes, watching his eyes. Once again, we're waiting at least a full minute. Then we come back to center, still on the 30-degree plane. We have to check the other side too. It's not positive unless both sides follow the geotropic or agiotropic rule. Right? On the count of 3, you're going to go to the left. 1, 2, 3. Watching his eyes. Wait another minute. Come back to the center. Yep.
But then you say they fix their gait on something you won't see nystagmus?
Yeah. So this is the testing position for infrared goggles. And that's the problem with not using infrared goggles. If it's a peripheral lesion, which if it's a peripheral problem, which BPPV is, they should be able to suppress their nystagmus, right? So when you're in room light, it poses a difficult problem for all of you, right? If you don't have goggles. One way to overcome this is to have a blank wall there, something where they can't specifically fixate on one thing. Usually in room light, people will still have some nystagmus, so you should be able to see a little bit, maybe. But in an ideal world, you would have infrared goggles to check their eyes. Let me show you how to check these positions without infrared goggles as well. So you can sit up. How do you feel? So come on back down to position. If I'm checking his eyes now for nystagmus, it's the same thing, but I want you to turn your head to the right on the count of 3. 1, 2, 3. Eyes open. Good. And so now I'm watching his eyes, so I can see it a little bit better. Let me show you the Dix-Hall pipe. You can sit up. Dix-Hall pipe can be modified, once again, for without infrared goggles. So let's say I'm testing his right side. You turn your head to the right. I'm going to hold your head here. On the count of 3, we're going to go straight back, okay? Onto your back with your head turned to the side. Ready? 1, 2, 3. So he's still in the same position, right? Head turned to the right, 30 degrees extension. But now I can watch his eyes very specifically and directly. And I don't have to reverse everything. Okay, you can sit up. So you're still supporting him on the posterior aspect, but you're down with him. Okay? Yes.
For some of these techniques, if you're right in front of him, won't he fixate on you?
Yeah, that's the problem. In an ideal world, we need infrared goggles. One way that you can do it, come on down again. Let's go just go down to position. While he's there, you can kind of have him look at a blank wall down that way. That way he's not looking at me, and I can still see his eyes. Like I said, they can suppress it, but they may not get it away completely, so you can still see it. Some people use a blank wall. Some people put a cloth up, like a hospital cloth, just something where it's a blank area, and you can see it. The other thing is you can sometimes rely on their vertigo. So if they have vertigo on the left side but not the right, you could take a gamble and say, well, most likely it's the posterior canal, statistically speaking. I'm just going to treat the posterior canal and see if you feel better. But I really encourage everyone to try to identify exactly what canal it is, and if possible through infrared lenses. They also sell something called Frenzel's lenses. So it's just a magnification of the eyes. So it's a set of glasses, they put them on. It's a lot cheaper than the infrared goggles because it's just really giant lenses. And it magnifies their eye, so they can't really fixate on anything, but you can see their eye really gigantically. It's a great, cheaper alternative to infrared goggles. And it's portable, it's very small, so they're just glasses. So there are many options for you guys to see nystagmus without fixation, and that's one of them.
Question?
Yes.
You said you start with the unaffected side. You're basing that over what they tell you as far as what
Yeah.
position they have it in?
Exactly, yeah. You could base it on if they roll to the left, usually then they feel it. If they stay at home, every time I roll to the left, I feel nystagmus. Yeah, I think I'll say that. I say I feel vertigo, I feel symptoms. The other way is we know that the labyrinthitis and Meniere's can cause the ear to be unstable enough to cause BPPV, right? It's one of the main causes. So if we know they had a labyrinthitis on their left side, for example, we can probably assume, well, we could say most likely BPPV is going to occur in that ear. So that's another way to tell one side versus the other. How do we know if they've had a labyrinthitis in their history? Did you have a labyrinthitis? No, you ask them, maybe during their history they say, 3 years ago I had this 48 hours of spinning. You went to the ER, it resolved on its own. And then they may see you 2 years later, and they have BPPV because their ear is now unstable. So they have a history of labyrinthitis, but you're not treating them for labyrinthitis, you're checking them for BPPV. Okay, so that's the roll test, that's the Dix Hall Pike. Let's go over the sidelining test real quick. This is, you just sit on the edge here.